The whole idea of what a nurse is, it's changing, and it's changing fast. We're about to dig into how nurse leadership is being completely reimagined and how that's reshaping patient care from the ground up. So let's just start with a basic question. When you think of a leader in healthcare, what really comes to mind? Is it the person in charge of a single unit, or is it something bigger? Well, it turns out the answer is a really big shift. It's not just about what happens at the bedside anymore. It's about having the vision and the skills to actually influence and improve the entire healthcare system. So this big shift brings us to our first key idea. We're seeing a new kind of leader emerge. What does it take to navigate the crazy complexities of modern healthcare? Let's find out. And this change, it's not just about learning a few new tasks. It's a total shift in how you see the world. It's like you got to zoom out from just one patient's chart to see the whole giant, messy ecosystem of healthcare, from policy and finance all the way down to a single person's experience. Okay, so if you're going to lead, you've got to see the entire playing field, right? And that means building a whole new foundation of knowledge. Let's explore what this bigger picture actually looks like. Okay, check this out. What I love about this image is how it shows this new language, this new vocabulary. Of course, you still see words like patient and care right there in the middle. But look at all the other words crowding in: strategic, finance, leadership, planning. It really shows you how much the world of a nurse leader has expanded. All right, so getting a handle on these key areas is a must. But what does that mean in the real world? It means you have to navigate the maze of health policy, use actual data to make decisions, understand the tough realities of budgeting, and, this is the big one, build strategic plans that actually create real, lasting change. And look, this isn't just some textbook theory. Listen to this. This quote, it just nails that aha moment. It's that sudden realization that things like budgeting aren't separate from patient care. They're actually essential for providing great patient care. Okay, so you've got all this new knowledge, but how do you actually use it to make a difference? Because knowing the theory is one thing, but applying it to drive real, tangible change, well, that's where the rubber meets the road. Let me give you a really powerful, real-world example. A nurse leader spotted a serious and often overlooked danger: toxic surgical smoke in the OR. This stuff is a proven risk to both patients and the staff breathing it in all day. And this is no small thing, right? This is a systemic problem that needs a systemic solution. So what did they do? They didn't just point out the problem. They led a full-on campaign. First, they dug into the research and gathered the hard evidence. Then, they started pushing for new equipment and actual policy changes. And this is the big one. They worked to build a real culture of safety to make sure those changes actually stuck. And the payoff? This quote says it all. Their leadership didn't just fix a problem, it earned their hospital a national award for safety. This is what happens when you turn knowledge into real action. And here's another great example of that. So before, you had this huge problem with vaccine storage errors, a big risk to patient safety. But then, a nurse leader steps in and gets new CDC guidelines put in place across the whole network. The result? Errors went down and a whole new standard of care was established. Okay, so we've seen how these leaders can tackle specific problems, but let's zoom out a bit and talk about leading people and big picture strategy. Okay, you've got to see this data. It's pretty fascinating. It comes from a leadership program and it tracks the key skills these leaders are working on. And look at this. The single biggest piece of the pie, more than a third of it, is communication and relationship management. I mean, what a powerful reminder that leadership isn't just about spreadsheets and plans, right? It's all about people. And you can really see that change right here. The image on the left is all about things like planning and policy. But look to the right. The focus widens to include teamwork, collaboration, and a more global view. It's a move away from just managing tasks to really building up your team. This quote right here gives us a perfect look into how this actually works. It's not passive. It's about getting in there and actively creating moments, like coaching, like team huddles, to build those communication skills and make those team relationships stronger. So let's bring it all together. What does all this mean for the future of healthcare? And this image, it just perfectly sums up the end goal. All of these different skills, strategy, finance, team leadership, they all come together for one single purpose: creating a system that's all about culturally competent, patient-centered care. And that right there, that's the whole journey in a nutshell. You go from someone who just follows the rules to someone who actually writes the rules. Man, this reflection from a student is just so powerful. It's that light bulb moment when you realize that nurses aren't just cogs in the machine. You're this huge force that can actually change the whole system for the better. That feeling of empowerment is what drives all of this. And that leaves us with one final, and I think really important question to chew on. With this new generation of strategic, empowered nurse leaders stepping up, how is that going to shape the health of our communities tomorrow? Really makes you think, doesn't it?